If you're over 65 and you have high blood pressure, your doctor has probably told you one of two things. Either you're fine or you need medication. But neither of those conversations answers the question almost nobody asks, which is this: at what exact point does your number stop being manageable and start being genuinely dangerous? Not merely high, not elevated, dangerous. Here's what most people don't understand. The same reading that's fine for one 70-year-old becomes a serious warning sign for another. The same medication that saves one person's life can actually cause harm in someone else. Most dangerously, the readings that signal real trouble aren't always the dramatic ones. My name is Dr. William Parker. For the past 18 years, I've worked with hundreds of adults navigating exactly this decision. Today, I'm going to show you the specific numbers, the specific warning signs, and the exact situations where your reading has crossed from managed into dangerous territory. Stick with me through everything today, because the third point we'll cover, the situation that changes your entire treatment overnight, is what most cardiologists wish every patient knew before it became an emergency. Before we talk about when your reading becomes dangerous, you need one critical distinction your doctor may never spell out this clearly. There's a fundamental difference between high blood pressure and dangerous blood pressure. Mix those two up and you'll either treat something that doesn't need treatment yet or ignore something that's already risky. Think of it this way: high blood pressure is chronic. It develops over years and requires monitoring, possibly medication. But it's not an emergency. You can have a systolic of 145 for months without an acute cardiovascular event. Dangerous blood pressure tells a different story. It's either, first, a single reading so extreme it signals immediate cardiovascular strain. Second, a pattern that indicates your arteries are actively being damaged. Third, a number that, combined with other factors, tips you into genuine risk territory. Let me make this concrete because generalities don't serve you here. Helen's story. Helen, 68, came to my office with a reading of 152/78. Her home readings from the previous 3 weeks were 148, 150, and 149. She was otherwise healthy, walking daily, no heart disease history, no diabetes. Understandably, she was anxious about the number. The verdict? High, yes. Dangerous, no. This reading warranted a lifestyle conversation and possibly medication, but it wasn't dangerous in a way that would change our approach this week. We monitored, we managed, we let her body respond to lifestyle changes first. Marcus's different story. Fast forward to Marcus, 71, with a reading of 158/92. What made this different wasn't the number alone, it was the pattern. His home readings over the past month were consistently 155/90, 160/94, 159/91. Additionally, he'd developed mild headaches he'd never experienced before. Sleep had become difficult. Climbing stairs now left him short of breath, something that hadn't bothered him a year earlier. That combination changed everything. His cardiovascular system was under active stress. We started medication that week, Robert's false alarm. Robert, 73, had maintained stable readings around 148/75 for 2 years on medication. Then one appointment, his reading spiked to 178/96. But when we retook it 5 minutes later after he sat quietly, it returned to 152/77. The single spike, that was a stress response. We didn't panic. We didn't change medication. We talked about what happened before the reading. He'd been in traffic. A family situation was causing anxiety. Notice the pattern here. The same number or even a dramatic spike could mean 3 completely different things. Context matters as much as the number itself. The critical point at your age, you need to distinguish between elevated readings and actively dangerous ones. Let me give you the actual thresholds that cardiologists use when making treatment decisions. I'm going to be specific because generic ranges are where most confusion starts. For adults 65 to 74, otherwise healthy, a systolic reading consistently above 150, taken multiple times with proper technique, warrants a serious medication conversation. Not panic, but change. A systolic above 160 combined with a diastolic above 95 moves you into territory where we're thinking about starting or intensifying medication relatively quickly, even without symptoms. A reading of 180 or above, particularly if accompanied by headache, chest discomfort, visual changes, or shortness of breath, requires medical attention potentially urgently. For adults 75 and older, the targets shift, and this is where most people misunderstand their care. Research supports aggressive treatment to below 120 for relatively healthy older adults. But there's a real J-curve for very elderly patients, meaning aggressive treatment can actually cause harm. A systolic of 160 in someone 78 years old with frailty differs completely from a systolic of 160 in an active 78-year-old. The number is identical. The meaning is different. Similarly, a diastolic that falls consistently below 55 in someone on blood pressure medication signals overtreatment. It means we need to ease up. Now here's where the actual danger usually hides, and most people never see it coming. The truly dangerous readings aren't always the dramatic spikes. The ones that genuinely surprise cardiologists are hidden inside patterns that seem stable on the surface. Patricia's hidden danger. Patricia, 67, looked fine on paper. Average systolic of 142, normal diastolic, but her blood pressure variability, the swing from lowest to highest, was enormous. One day 128, the next 165. That variability, even with a reasonable average, became its own cardiovascular risk factor. Your blood vessels need consistency. They adapt to stable pressure. They struggle with chaos. Patricia's arteries were being damaged by the swings more than by any single number. Tom's slow progression. Tom monitored consistently at home. 148, 150, 146, 152. Over 1 year, his baseline crept upward, just a point or two each month. 12 months later, he was averaging 158, 18 months in, 163. This gradual progression, if unaddressed, leads to the moment when your reading is suddenly dangerous. You didn't see it coming because you were focused on individual numbers rather than the trend. The third hidden danger, the combination systolic 145, diastolic 92, the gap between them, pulse pressure, is 53. That specific combination tells us something precise. The top number is elevated, but the bottom isn't falling normally. Your blood vessels may be stiffening in a particular way. Is 145 systemically dangerous alone? For many people, no. But 145 over 92 tells us something about what's happening in your arteries that 145 over 70 doesn't. Your reading is one piece of information, but 5 specific warning signs tell you when your number has moved from elevated into dangerous territory. Most people miss them or attribute them to something else entirely. Warning sign. 1. New onset headaches tied to spikes. This differs from chronic headaches. It's pressure at the back of your head that appears when readings climb above 155. That correlation matters. It's not definitive proof of danger, but it's your nervous system registering the strain. Warning sign. 2. Exertional symptoms that are worsening. Shortness of breath climbing stairs that didn't bother you 6 months ago. Chest discomfort during a walk. Fatigue disproportionate to the activity. These aren't about the reading itself, they're about what elevated pressure is doing to your heart's pumping efficiency. Warning sign. 3. Cognitive changes. Difficulty concentrating, moments of fogginess. Some research suggests that elevated pressure, particularly with high variability, affects blood flow to the brain. It's not dementia, it's not normal aging, it's your brain signaling that cardiovascular stress is building. Warning sign 4. Sleep disruption tied to your readings. If your sleep quality has declined since your numbers started climbing, that's not coincidental. Elevated pressure stresses the autonomic nervous system. Your body can't relax into sleep the way it should. Warning, sign 5, waking with elevated readings. Some people notice a consistent pattern where morning readings are significantly higher than afternoon ones. A systolic of 165 in the morning that comes down to 145 by noon tells us something. Your blood vessels aren't relaxing overnight as they should. That's an active warning signal. Having any of these 5, that doesn't mean you're in immediate danger. It means bringing it up specifically at your next appointment and monitoring more frequently at home. Now here's the critical threshold where you stop waiting for your next scheduled visit. There are specific combinations of numbers and symptoms where your reading has moved from dangerous into emergency territory. I want to be extremely clear. If you experience any of the following, you need emergency care, not an urgent visit, not a call to your doctor tomorrow. Emergency care. The hypertensive emergency criteria: a systolic reading above 180 and a diastolic above 120 combined with any of these symptoms, severe headache unlike anything you've experienced before, chest pain or pressure, severe shortness of breath, visual disturbances, blurred vision, spots or visual loss, severe anxiety or a sense of doom, numbness, tingling or weakness in your face or limbs, confusion or difficulty speaking clearly. That combination, the extreme number plus the symptoms, is a hypertensive emergency. You need emergency care immediately. Hypertensive urgency is different. A systolic above 180 without those severe symptoms is called hypertensive urgency. It's still serious. It still requires same-day medical contact. But it's not necessarily a 911 situation if you're completely symptom-free. Here's where people make mistakes. They assume that because they feel fine, a reading of 185 can wait until next week. That's not accurate. A number that high needs professional evaluation the same day, even without dramatic symptoms. What James missed, James, 69, woke to a reading of 182 over 98 at home one morning. He didn't have chest pain. He didn't have the worst headache of his life. He felt completely fine. So he scheduled an appointment with his doctor for the following week. What he didn't know, his pressure had been climbing over several months. That single 182 reading was the tip of an iceberg. When he finally came in for evaluation, we found early signs of organ strain he couldn't feel. The takeaway, a reading of 180 plus requires evaluation that day, symptoms or not. One final detail. If you're over 75 with frailty, or if you have orthostatic hypotension, meaning you get dizzy standing up, aggressively chasing lower numbers can be dangerous. We've seen patients have falls or strokes from overtreatment. This is why lower is always better is terrible guidance for blood pressure. Your number is your number at your age with your specific health situation. If you've watched this far, you're probably thinking about your own readings right now. Here's what I want you to do starting this week. Step 1. If you haven't taken your reading at home in the past 2 weeks, do it this week. Take it 3 times over 3 different days. Same time each day, after sitting quietly for 5 full minutes. Arm at heart level, back supported, no talking. Write down all 3 readings and calculate the average. Then calculate your pulse pressure on each one. That's systolic minus diastolic. This single calculation reveals something important about your arterial stiffness. Step 2. Look back at your last 5 readings, whether from home or office. Are they consistently climbing? Are they stable? Are they erratic and unpredictable? Each pattern tells you something different about whether you need to act. Step 3. Most doctors will spend 5 minutes reviewing this and have a meaningful conversation. Most won't unless you bring it organized this way. Step 4. This doesn't mean obsessive daily checking. It means consistent, predictable monitoring. I recommend once daily at the same time, 3 days a week. If you're starting new medication or your readings begin climbing, increase frequency. A quality home monitor from a validated brand, the American Heart Association, has validated options, costs $30 to $50, and gives you far more useful information than waiting for office readings. Step 5. These are the specific numbers that trigger a medical call. A single reading above 180, same-day contact. A pattern of readings consistently above 160, appointment within 1 week. Any combination of elevated reading plus new symptoms, same-day evaluation. A systolic suddenly higher than your previous pattern by 15 plus points, worth mentioning at next appointment. Right now, think about whether you know your action points. Most people don't, which is why they either overreact to one high reading or ignore a dangerous pattern. That changes today. Before your next doctor visit, ask these 5 specific questions. Your physician will appreciate them. If they don't, that tells you something important about how carefully they're thinking about your individual situation. The blood pressure safety checklist. Question 1. Looking at my readings over the past 3 months, am I in a worsening trend, stable pattern, or improving? Most doctors won't volunteer this, but trend matters more than any single number. Question 2. What's my specific systolic target, and does it account for my age, frailty level, and fall risk? A target of 120 may be harmful if you're at risk for falls. A target of 140 may be insufficient if you're very healthy. Question 3. My pulse pressure is calculated. Does that number tell you anything about arterial stiffness we should discuss? Most doctors don't calculate this. If your pulse pressure is above 65, it's worth mentioning by name. Question 4. Have I had any symptoms since my last visit that correlate with my reading, headaches, shortness of breath, or cognitive changes? Connect symptoms to your readings. Don't let them exist separately. Question 5. If my reading reached, what would be your preferred action? Call immediately, schedule an urgent visit, go to emergency care. Know the action points for your specific situation, not generic guidelines. A good physician will say, "I'm glad you're tracking this. Here's exactly what these numbers mean for your situation." If you get dismissive responses or vague answers instead, that tells you something about the partnership you have with that physician. Here's what I want you to hear. Your reading at 65 and beyond is one of the most modifiable risk factors for cardiovascular events. But that's only true if you understand what your numbers actually mean and when they've crossed into genuine danger. The difference between a doctor who monitors your reading and a doctor who understands your reading is the difference between someone reading a number and someone understanding what that number means for your specific heart, at your specific age, with your specific health history. Most doctors don't have time to explain this level of detail in a 15-minute appointment. That's not their fault. But it means you have to take responsibility for understanding it yourself. Starting today, I want to leave you with a specific action. Your 30-day blood pressure clarity challenge. For the next 30 days, take your reading 3 times a week at the same time of day. Using correct technique, after 5 minutes of sitting quietly, back supported, arm at heart level. Write down all 3 numbers. At the end of 30 days, you'll have a pattern. You'll know whether your readings are stable, climbing, or variable. You'll know your average and your pulse pressure. You'll have organized data that will make your next doctor appointment infinitely more productive. Most people have been monitoring for years without ever looking at the pattern. After 30 days of organized data, you'll know more about your cardiovascular risk than most people learn in a decade. Bring that log to your next appointment. Ask your doctor to look at the pattern with you, not just individual readings. If this video helped you understand your reading better, subscribe. That's exactly what this channel is built for. Science-based, actionable information for adults over 65 who want to understand their health deeply, not superficially. And grab the free blood pressure safety guide linked in the description. It has the complete checklist, your action points, and the specific criteria for when to seek emergency care. Thousands of people in this community are using it. You have every right to understand exactly what your numbers mean, why they matter, and when they've become genuinely dangerous. That understanding starts with 1 correctly obtained reading and 1 calculated pulse pressure. That's all it takes to begin a better conversation with your doctor. I'll see you in the next one.